Hi, Courtney Cullen from Sanford Health News here. I have Martha Leclerc, Vice President of Corporate Contracting and Strategic Reimbursement with me now. She is attending the 14th Becker's annual meeting in Chicago. Martha, good morning. Thank you for being here.
Good morning, Courtney.
We know that economic and policy trends are influencing healthcare today. Martha, what is one thing or a couple of things that you're taking away from this conference as some key issues that will shape the future of rural healthcare?
We had a really great conversation this morning in our panel about just that particular topic. And I would say that a lot of people in the audience and the panelists really, really understand that there's a lot of uncertainty happening in Washington, a lot of dysfunction in Washington, and we're always kind of waiting for that next decision or that next issue to be resolved. We're kind of always holding our breath. And so that uncertainty kind of trickles down into the industry. And an industry that is so highly regulated, that uncertainty, obviously has a big impact on us. And I think that, in terms of the rural aspect of it, there are many programs that have been initiated out of Washington and that have great intent. But when it comes down to the specific impact on our facilities, on rural facilities across the board, there's a lot of unintended consequences. And so I think that another really strong kind of conversation that we had this morning was the fact that we are obligated to be constantly educating our elected officials so that they really understand the issues that we're facing in the field, boots on the ground, in delivering healthcare.
Thank you so much for sharing. Now, what three adjectives would best describe your view of economic and government policies that will shape the future of rural health, Martha?
Wow, it's probably uncertainty, obviously, is one of them. Accountability is another word I think that I would use, and accountability, again, on our part to make sure that we are countering some of the misinformation that is out there. And so responsibility for us to be constantly telling our story and to be constantly educating people about the importance of rural healthcare, the importance of nonprofit healthcare, and all of the great things that we're doing to serve our patients.
Well, we thank you so much for your insight and your takeaways and appreciate all that you do, Martha. Thank you so much.